Hello, this is Dr. Emre Karadeniz, hair transplant surgeon from AEK Hair Clinic, Turkey. I'm going to talk about hair transplant coverage and density, which is a very critical issue and frequently asked. So I'll try and kind of give a general overview. If you look at the natural density of the scalp, you will see differing from patient to patient, ethnicity to ethnicity, you'll see on average a follicular unit density of around 80 follicular units per square centimeter. This correlates to approximately 200 hairs per square centimeter of an area. Now, when you look at hair loss, so if you make a scale between 0 to 100% in density, and if you look at our hair, we start realizing that our hair is thinning when we are close to 50% our original density. So that means from the 200 or 250 hairs that we actually have, when we reach a hair loss of 100 hairs, we start realizing we are thinning. That means the hair starts becoming see-through. Now, if you look at hair transplant densities, you have to understand that the highest transplanted density is around 50% original density. This is like the difference between a natural rainforest, which the trees actually grow from the soil with the pollens distributed. The plants will grow so thickly that you may find that even light doesn't pass through these trees. Now, if you want to do a garden and you plant mature trees, you can't do it like a rainforest. You'll bring mature trees and you'll dig holes that are a couple of meters apart. If you do them so closely together, most often they will hit each other and they will not survive. So their roots will damage each other. So you have to put a certain distance. So hair transplants are similar. Because we dig in a hole surgically and we bring a mature hair to put in, the density we can do in those technical limitations is on average 50% original density. But thank God that 50% looks very close to native density. So if we can get 50%, that's 100 hairs per square centimeter, or a little bit above that, this will mimic very close natural density. We call this cosmetic density because mathematically that's only 50%, but visually it looks close to normal. So we have to know this limitation. This limitation also becomes an advantage because that means when we harvest donor hairs, we can cover a bigger area than these hairs would actually cover in nature. To understand coverage, now patients frequently ask, I want it all covered, or how much can you cover? Now the problem here is that you can actually cover with any given hair number or graft number, you can cover an area that you want, provided that you reduce the density. If the density is not determined, then we don't know how much this will cover. And there will be a difference, significant difference of coverage depending on how much density you try to put in. Professional clinics will usually try to prioritize density. So they will do a much smaller area than unprofessional clinics and give a high density in that region. And then in another surgical session, they'll try to fix another area. Unprofessional clinics, because it's much easier to do, will generally spread out in a whole area evenly the hairs that they harvest because it's much easier to technically do. Now, patients tend to go for a surgeon or a clinic that offers more coverage, but they don't realize you can increase the area of coverage by reducing density. So if you don't know which density they're going to operate at, then knowing the coverage doesn't mean anything. So you have to know both of these factors. Now, hair transplants are very, very labor-intensive procedures. And I'll give you a general idea about the coverage or density you can expect. FUE is a frequently used technique. In FUE, if you harvest around 5,000 hairs, and depending on the hair per graft ratio, this could be anywhere between 1,800 to 2,500 grafts. It takes the surgical team of a surgeon and perhaps 2 or 3 assistants. It takes 6 to 8 hours, so it takes a full day. So if you don't kind of do a bodged job, very fast, damaging grafts, if you really take care of what you do, in one surgical day, that's under 8 hours, you're going to do approximately 5,000 hairs or around 2,000 grafts, roughly speaking. And when you look at coverage, if you want to give a good density, you must put, as I said, 100 hairs per square centimeter. So if you put 100 hairs, or you could put even more, then 5,000 hairs is going to cover an area that is 50 square centimeters. Now 50 square centimeters is like a 7 by 7 square. It's about this much. Something like. In general, that's like the frontal region, or it can be the crown. It's an area like this. Now, in a very bald person, the recipient area may be up to 200 square centimeters. And if you multiply that by 100, you may realize that this would take up to 20,000 hairs to cover with a good density, which is never possible with a single surgical session and single method. A surgical session, a reasonable session in FUE or strip, is going to give about 5,000 hairs, 2 to 2,500 grafts. A very large session is going to give you 3 to 4,000 grafts, perhaps, and perhaps 10,000 hairs. So you're looking roughly between 5,000, could be less or more, but 5,000 in a normal session, or 10,000 in a huge session. Mind you, in FUE, we would do that in 2 surgical sessions most of the time, because you can't do that much in one session. But even if you do 10,000 hairs, and that's actually 100 square centimeters of coverage. So unfortunately, in hair transplants, there's a lot of work to be done to, let's say, cover up a moderate region with good density. Of course, if you sacrifice density, then you can cover a huge area. So you have to always keep in mind there's 2 aspects to this: coverage, but also density, and they're opposites. So the more coverage, the less density. The more density, the less coverage. So you have to realize these 2 sides of the scale. So I hope I was able to give you a general idea about how density issues work, and the native density, the hair loss density, and the transplanted density. So you need to understand the rough relationship between all these 3. Thank you for watching this video. I hope it has been helpful, and see you in the next educational video. Goodbye for now.